We've been looking at global conversation initially on Twitter about how people communicate with each other around the 16 topics of the development agenda. And of course that turns out to be in ways that are very different than how people talk about these topics in a policy context. People are talking about how lack of access to health care, good education, clean water affects their lives. And it's messy, subjective, perceptual human conversation. What we find, of course, is that you have a lot more color, you have a lot more nuance. You see a lot more relationships between and across topics. And I think there's a lot of potential to understand the context in which people talk about different aspects of these topics that can really help us understand what's important globally, what's important to specific populations, to men versus women in country A, country B. I think that paying attention to how people are talking about these issues in their own natural language, in their own idiom, in their own online conversations publicly with one another is really, really critical to making sure that we're aiming at the right targets. What there's been is a lot of academic research showing the potential of the data sources, but not a lot of examples of operational success. There's a pretty well-known case where FlowMinder was able to extract information on population displacement in Haiti following the earthquake and make this information available so that it could be used to predict where cholera outbreaks were likely to spread to next. If you see that a certain number of people have been displaced to a nearby town from an area where there was already cholera, that's probably where you should look for targeting your interventions next. Being able to see where parents aren't vaccinating their children and why, being able to see where people have less money to spend on mobile communications, for example, being able to understand where people are talking more about smoking or drinking, not exercising could be useful for understanding the risk of non-communicable diseases. Being able to understand where people don't show any awareness of how you contract HIV can be very useful for targeting programs. So there's a lot of signal and there are a lot of methodologies. What we need now is evidence of end-to-end success. It's fine and good to be able to understand the risk of re-identification of someone from a data set, but then you also have to think of the potential for abuse of that information once re-identification has occurred. And there, the risk modeling is completely different. If you can re-identify someone in a way that, for example, identifies them in terms of their ethnicity, in terms of their religion, in terms of their sexual orientation, and then you're dealing with a particular context where there's high potential for discrimination based on that re-identification, then you're dealing with very clearly a human rights issue. This isn't merely a privacy issue. So I think the point here is that we have to develop frameworks to understand how data can be shared, how it can be processed, how it can be used in ways that maximize utility and minimize the risk of creating new vulnerabilities for the same populations that we're hoping to help. People all across sub-Saharan Africa, for example, are on the radio and they're calling in to radio stations and talking about what's happening in their communities. They're texting in. We see an opportunity to build tools that can transcribe these public conversations, very analogous to Twitter, and online news, these public conversations into a text transcript that could then be analyzed so you could see where people are talking about flooding, where they're talking about rising food prices, where they're talking about the symptoms of dengue fever. This could provide whole new insights in areas where you don't have a lot of internet penetration, where you don't have a lot of social media usage. We could suddenly get text, and that would be very exciting.